Now, one of the areas that has been a strong focus has been the area of disability. Many of you are experts in this community, and we see ourselves as trying to bring together the disability community with the health IT community to be at that interface. It certainly is a large community with over 50 million Americans reporting some level of disability. And relevant to the Washington location of this forum, a lot of federal dollars are expended in the disability area. SSA, and we have representatives from SSA here, it spends approximately $128 billion in disability payments. Medicaid as well, over $100 billion a year. I think Steve Kay later will have some additional statistics. The point is, it is not only a major segment of society, it is also a major segment of the public budget. And so there is a need to think about this space and the role of e-health, and in particular personal health records. Now, what's the problem to be addressed? What's the situation to be addressed? One is that the filing for disability requires assembling, a broad array or wide range of health and medical assessments, and so that's one enterprise that needs to be, attended to. The second is that there's a parallel and sometimes subsequent need for this information in coordinating rehabilitation and health care within the disabled community. And so these parallel needs are something we've been tracking. You'll hear some more about that in a second. I want to say at the outset of this third point that there will be acronyms in today's event. We try to keep acronyms to a minimum, but here's the first one. We've been thinking through this concept of an electronic disability record, which is really the application of what's called the electronic health record, and the electronic medical record, and the personal health record, and any other three-letter acronym that you can come up with. And so we knew it had to have three letters, and so EDR is it. The general point, and I think David will get a bit more into the health IT side, is that there can be an application of personal health records to the disability space, and that's what we've been looking at. Now, we first ventured in this domain last fall in terms of forums by doing an exploratory event, and many of you were there, and we really appreciated your participation, where we thought about linking people with disabilities to the National Health Initiative. And we came up with two areas to focus on, what we called use cases, and some of this is contained in a paper, which I'll mention again in a minute. It's in your packet. One is the use of electronic disability record for disability determination, and the second for service coordination and personal health management. And then we thought through what it might mean for what's happening in the health IT space in terms of electronic health records and personal health records. Three high-level findings from the forum are as follows. One, there is the promise of personal health records in improving the efficient and easy access for medical records when assembling information for disability determination. There's also the potential to eliminate the issue of unidentifiable treatment resources. Where did this x-ray come from? Or how do I get this x-ray kind of thing? That was done 10 years ago. Third, it can provide a more structured and standardized means for getting medical information to make a disability determination. The whole point there is to reduce the unnecessary delay in the onset of disability benefits for somebody who needs and deserves those benefits by bringing the efficiencies of health IT, bringing Quicken books to the health information space. The second area, in terms of health management, there were a couple of findings. One is that there can be a way for an electronic system to provide critical accommodation in health information. What are the accommodation needs of someone? What critical health information is needed to know about someone in case of an emergency or in a day-to-day situation? Now, these are kind of the promises of personal health records in helping with disability determination as well as health management. There are a number of issues that were raised by the stakeholder groups present at the fall forum. I'm going to outline three and then ask Susan if she cares to make any additional commentary. The first one, no surprise, is privacy. How will privacy be safeguarded? It's an issue in general, as many of you know, for health IT, but when talking about various forms and applications within the disability community, it can be particularly acute, whether it's AIDS or mental health. It really represents a major test of the privacy concerns within the electronic health arena. Second, usability. How accessible are personal health records in various ways for various forms? And that's obviously a key issue within the disability community. And third, portability. That is, over time, many forms of disability are lifelong, and so the records are lifelong, and people move around. And so how is portability within the personal health record space? And how can that be made a positive and not a negative? And so those were three issues that were raised in the exploratory forum that was done in the fall, and as I mentioned,